Support for Radio Friends comes from La Brunerie Financial, where they work to ensure a lifetime of financial security for people from all walks of life, from investment services to retirement plans. If you're looking for a trustworthy company that has the experience and knowledge to put your interests first, contact La Brunerie Financial, a community-based investment counseling firm since 1966. Good morning and welcome to Radio Friends on this Monday, May the 17th. Always a pleasure to have you with us. And today we have the husband and wife dental team with us, Dr. Philip Batson and Dr. Elizabeth Abe from Columbia Healthy Smiles. Good to have both of you here.
Thanks.
We try to cover many different topics with dental health. One that we have not touched on in depth yet is gum disease. And this is something that can affect everybody if you don't take care of your mouth. What precisely are we talking about when we talk about gum disease?
So when we talk about gum disease, we talk about what a lot of people have probably heard on the commercial sometimes is gingivitis, and that's inflammation of your gum tissue. And then that can progress to more advanced gum disease called periodontitis, where that is not just inflammation of your gums, but it also is beginning to see bone loss.
See, I was reading about that today. How do you pronounce that word again?
Periodontitis.
Periodontitis. Is that something that comes on after the initial gingivitis? Or
Yeah.
can it start all on its own?
No, gingivitis leads to periodontitis. So gingivitis left untreated will progress to periodontitis.
How do you treat gingivitis?
Gingivitis can just be treated by taking good care of your oral health at home and coming in for your regular 6-month cleanings just to keep that inflammation down and reduce the plaque that you have in your mouth.
How do you know if you've got gingivitis?
If you looked in the mirror, it would typically look like your gums are red and inflamed or they're bleeding. That would be signs of gingivitis.
If your gums are red or inflamed?
Mm-hmm. And
sometimes you see it after you floss, if bleeding after flossing or bleeding after brushing even.
Now, just because your gums bleed doesn't mean you have gingivitis, though, is it?
It's a pretty telltale sign because that would show there's a bacterial component in the gum tissue right around the tooth that's causing that inflammation.
So if your gums are bleeding and you've got gingivitis,
most likely.
What if they bleed just once in a while?
Once in a while it can be isolated. It can be an isolated incident, but if they bleed consistently and when you're brushing or flossing or doing things like that, then that's a sign that you have that inflammation there.
Then if you have that inflammation, will it go away after you have properly cleaned your teeth with the hygienist and you've brushed them? Will it go away, or do you need to have antibiotics at times?
So it will go away if it's in that gingivitis stage. If it's periodontitis, sometimes we do what we call a deeper cleaning of your teeth to get rid of the bacteria that you have there. And so the idea is with good home care that, it will get to a healthy state because what we want to see is firm and pink gums.
I was also reading that gum massage helps alleviate gingivitis. And there's an instrument that you can buy that massages your gums. Have you heard about that?
Not a gum massage instrument per se, but I do know, like a water pick type instrument that shoots water.
Maybe that's what I was...
In between, yeah, and that can be a good adjunct to the other cleaning. It's kind of like a power washer for your teeth. It goes in, blast off debris, blast off things in between the teeth, but then you still get in there with the floss afterwards.
But that's massaging your gums, isn't it, when you use that?
It's able to get down below the gum tissue a little bit that's around the teeth and kind of debride those areas a little bit.
Okay. If you have gingivitis or if you have the other...
Periodontitis,
can it lead to other health issues in your body?
So that's what they do say, that the bacteria can, but also some health conditions lead you or make you more prone to having periodontitis. So the big factors are smoking and diabetes.
Smoking and diabetes.
Yeah, those are the big ones that lead to periodontitis or that bone loss.
And smoking is something that you can cut that risk simply by stop smoking. Tobacco is not good for your mouth, is it?
Not at all.
And it can cause oral cancer also.
Absolutely. And so chewing tobacco or using cigarettes, anything like that are not good for your mouth at all, or gum tissue.
If you've got gingivitis and it's treated, how long is it going to take before your mouth gets back to the healthy situation again?
That can vary by everybody, just because we all have bacteria in our mouth, and there's good bacteria and bad bacteria. Some people have to overcome more bad bacteria than the good bacteria. So to get back to health can take some people longer than others to get to that pink and firm, gum tissue we like to see. And then and it can take longer if it has progressed to the periodontitis, like we've talked about, because if we think about the gums and the bone around the teeth, that's our foundation. The teeth are like the homes and the skyscrapers. So it's all about maintaining a good foundation for those teeth, so that you want to prevent bone loss, because bone loss is when we get tooth instability, mobility, and that can lead to tooth loss potentially. And so that's why it's really key to stay on top of it. And if you do have periodontitis, you might need to go in, like Dr. Abe said, for deeper cleaning, and then see the dentist or the hygienist a couple extra times during the year for additional gum therapy.
Yeah, and I know everybody's mouth retains bacteria in a different way, doesn't it? Some people, it's like building up plaque. No matter what I do, I brush 3 times a day, I use the water pick, but I still, when I come in to you still are scraping plaque off. And it's frustrating. Why is that? And then other people do the same thing that I do, and maybe not as much, and they don't have the plaque buildup.
Yeah, and so sometimes that what we call plaque turns into tartar, or what we call calculus, and so that's oftentimes what the hygienist is removing. Some people do calcify that a lot quicker than others, and that can be a factor.
Yeah, so even if you're doing everything that's right on a regular basis, you still need to see your dentist to do that cleaning.
Yeah, because once it hardens and that plaque turns into the tartar, the hygienist has those specialized instruments that can get that off. The toothbrush can't brush that away once it calcifies onto the teeth.
Okay. All right, if you want more information on all of this, and they won't hurt you when you go in, it's pain-free. You can give them a call. What's your number?
573-875-7071.
Okay, or on the web?
At ColumbiaHealthySmiles.com, and we also have Facebook and Instagram if you find us that way as well.
Okay, and you promise that there is no pain.
We strive for that every day. Yes, sir, Paul.
I know, that was a big thing. It used to, I remember when I went to the dentist for the first time, I must have been 7 or 8 years old. It was painful, and that stayed with me forever. It's different nowadays, so if you haven't been to the dentist, trust me, it's okay, all right? We're out of time for today. If there's something you would like to hear or see, drop me an email, pepperpete@missouri.edu. Bye-bye.